Hello, Allegiant CNAs. I am here to review some vocabulary words that have been received from several different students. I have reviewed the vocabulary words and I have placed them under the category personal care. So hopefully this little quick review will assist you. Let's get into it. We're going to start by talking about hair care. Remember, any personal care that you will provide to the resident, you will first consult with the care plan and the nurse before providing any care. With hair care, we're going to comb or brush the hair in small sections. You're going to begin towards the end of the hair and you're going to work your way up towards the scalp when you are combing the hair. You want to style the resident's hair according to the resident's preference. It is their right to determine how they would like their hair styled. The comb and the brush should be cleaned after each use. We are providing hair care to clean the hair of dirt particles and dead cells. It also stimulates circulation of the scalp. Providing hair care improves one's appearance, and it helps the resident to feel better about themselves when their hair is clean and neat. You should be providing hair care in the morning and throughout the day as needed. How often should we wash the hair? Once again, you're going to refer to the care plan. Usually, in general, we'll wash the hair at least once a week, but that is if it's listed in the care plan. When you are drying the hair, you're going to use a hair dryer and you're using a hair dryer. You want to remember to keep the hair dryer moving. You don't want to have the hair dryer in one place to cause damage to the scalp or burns to the skin. So whenever you're using a dryer to dry the resident's hair, you want to keep the dryer moving. If the resident hair is tangled, you want to detangle the hair. And once again, you want to start from the ends of the hair and work your way up to the root. If the resident's hair is matted and tangled, you want to notify the nurse and ask for further directions. You never want to cut a resident's hair, even if the resident has asked you to do so. Whenever a resident is asking you to cut their hair, you want to notify the nurse and refer that resident to the nurse. As a nursing assistant, you should never cut a resident's hair, even if the resident is asked to do so. Most long-term care facilities have beauty shops with beauticians and hairdressers that handle the trimming of the resident's hair. When you are providing hair care, you should be observing the hair and the scalp for sores, dandruff, lice, and nits. Lice are easily spread from one person to the next. Lice can be spread through clothing, through furniture, through bed linen, and through sexual contact. So any observation of lice, you want to report to the nurse. Pediculosis is the medical terminology used for lice, which pediculosis means the infestation of lice. Lice is tiny parasites that attach themselves to the skin or to the hair, and they can cause the residents to experience intense itching, scratching, and a rash. It can be found in the hair, it can be found behind the ear, it could be found on the neck. So you want to report any observations or any symptoms of lice to the nurse. And remember that they can be spread rapidly and is transmitted from one personal item like a comb or a brush or clothing to another. And it also could be transmitted through sexual contact. Personal items of the residents should not be shared. We will have to use hot water to wash clothing and linen in order to kill lice. Items that cannot be washed in hot water can be placed in a trash bag and left for 2 weeks in order to get rid of lice. Scabies is another insect that can be found on the skin. It's a tiny wingless insect. It can also cause rashes and intense itching. The itching is usually located between the fingers, around the wrist, and in other areas of the body. Let's talk about nail care. Nail care is another personal care that you will provide to the resident. First, you want to look at the care plan to determine if it's okay for you to give nail care to the resident. Remember, each resident has a care plan that will give you detailed directions on how to provide care for the resident. It will notify you what you can do and what you cannot do, and how frequent things should be done. So always refer to the care plan. Remember, fingernails can collect and harbor microorganisms. It's important to keep our hands and nails clean to prevent infection. Nail care is a part of the bathing process. Long nails and jagged or ragged nails can scratch the resident themselves as well as visitors and staff. So we want to try and file and trim nails when possible if the care plan allows it. Dirt that has collected under the nails is a source of infections. Before we provide nail care, in order to make the nails more manageable, we should soak the nails in warm water before cutting them or trimming them for at least 5 to 10 minutes. Prior to soaking or submerging a resident's hand in any water, you want to make sure that you have tested the water with a water thermometer, or you have tested it against your skin. It's also a good idea to allow the resident to test the water before you submerge the resident's hand into the water to soak. You want the resident to verify that the water is at a good temperature that's okay for you to soak their hands in. You also want to let them know when the time has expired for them to soak their hands. So if they're going to soak their hands for 5 minutes, when that 5 minutes is up, you want to let them know the 5 minutes is up and we're done soaking your hands. You want to dry their hands, and you want to go ahead on and clean the debris from underneath their nails. You will be using a orange stick. You'll use one end to clean the debris from underneath their nails, and the other end in order to push their cuticles back. You will also be filing the resident's nails according to their preferences. We are performing nail care so that we can decrease bacteria buildup that's under the nail. This is going to prevent infection. We want to cut and trim nails, long nails, and jagged nails to prevent scratches to the resident themselves, to the family members, or to staff. And also, nail care gives the resident a neat appearance, and it is good for their dignity. How often should we give nail care will be determined on the resident themselves, because the nails grow at different rates for each person. Nail care will be done as needed depending on an individual. When you are performing nail care, some observations that you should make are any cuts or any calluses that may be present to the hands or to the skin. You want to report any changes in the skin color, or any complaints of tenderness, or any complaints of pain while you are performing nail care. We are soaking the nails to make them softer. That makes it more manageable. And remember, prior to soaking the nails, you want to make sure that the resident has tested the water and that the water is at a safe temperature for you to soak their nails. You want to make sure that the water is in the temperature range of 90 to 105 degrees. It should not be hotter than 105 degrees. Be aware that some facilities do not allow nursing assistants to cut, trim, or file nails of residents with certain complications like decreased circulation, delayed healing. Residents that have diseases like diabetes are some of the reasons why some facilities do not allow the nursing assistant to actually cut or trim the nails. Cutting or trimming the nails to a resident that has diabetes can cause serious infection if the skin is accidentally cut while you're performing nail care. And so the skin that is compromised can lead to a severe wound and even amputation for a resident that is diabetic. So you always want to check the care plan to make sure that it is okay for you to perform nail care. Some residents with certain disease processes you cannot provide nail care for them. Some facilities have a podiatrist to come in and provide nail care for residents who have diabetes or illnesses that causes delayed healing or decreased circulation. Now we're talking about bathing a resident. Once again, even when you're bathing a resident, you're going to always refer to the care plan. You're going to talk to the nurse about any limitations that the resident may have. You want to know what their limitations are before you begin the bath. You also want to gather your supplies before you begin the bath, and you want to make sure that the environment is safe before you begin. You want to make sure there's no water on the floor, that there are no slipping hazards, there are no objects in the pathway that the patient may have to walk through in order to get to the shower or to get to the actual tub. You want to make sure that the tub or the shower is clean before and after use. You want to make sure that you gather all of your supplies. And once again, make sure that the floor is dry and that the environment is safe for you to actually carry out bathing or showering a resident. It's okay to use non-slip mats in the regular tub or the shower to prevent slips or falls. And you want to encourage the resident to use the grab bars when they're moving in and out of the tub or in and out of the shower. You want to use your privacy curtain, or you want to make sure that you're providing privacy when you are giving a resident a bath. You also want to follow standard precautions when you are bathing a resident. For those residents that are confined to a bed, in order to provide privacy, you can use a bath blanket. You can give the resident a partial bath. A partial bath includes you washing the resident's face. You're going to wash their hands. You're going to wash their underarm and their perineum. Their underarm is also called the axilla. So you're going to wash their face, their hands, their axilla or underarm, and their perineum when you are providing a partial bath. When you are washing the face, do not use soap on a resident's face. When giving a complete bath, which is the opposite of a partial bath, you're going to wash the resident's entire body. Your complete and partial bath are going to be given to residents that have difficulty getting in and out of the bed in order to use the tub or to shower. The tub bath can take place in a regular tub or in a specialty tub like the whirlpool. Keep in mind that when a resident is submerged in a whirlpool, a doctor order has to be in place, and there also has to be an order for the specialty or additives that may be added to a specialty tub, like bran oats, sodium bicarbonate, or Epsom salt. There must be a doctor's order for these additives to be used when a resident is in a whirlpool tub. When a resident is in a whirlpool tub, it can cause them to get a little bit weak. It can cause them to get dizzy. So you want to make sure that you are a standby assist and you are observing the resident even after they have exited the tub, at least for 10 to 15 minutes for dizziness and weakness as a result of being submerged in the whirlpool tub. Residents that are eligible to utilize the tub will not have problems sitting upright or transferring in and out of the tub. You want to make sure that your resident doesn't have any problems with standing before they are given a shower. And if a resident is in a shower and they begin to get weak, you want to make sure that you utilize the shower chair, and you want to make sure that you apply the brakes for the shower chair so that you can continue cleaning their skin. When you are bathing a patient, this is the perfect and opportune time for the nursing assistant to observe the resident's skin. Remember that when we are bathing a resident, this is going to increase circulation to their body. It's going to help prevent pressure injuries. And then we're going to be observing the skin for any discoloration in the skin, any imperfections or any bruises, any type of rash, any swelling that we observe while we're bathing the resident. We want to make sure that we are reporting these to the nurse. When you are bathing a resident, you want to avoid transferring microorganisms from a dirty area of the body to a clean area of the body. Remember, you're going to be washing from the cleanest to the dirtiest. For example, you will clean the face first before cleaning the buttocks. So in a quick review, when we're bathing a resident, we always want to make sure that we are providing privacy, whether we are closing a door, pulling a privacy curtain, or using a bath blanket. We want to keep the resident covered as much as possible. We want to make sure that the body is not unnecessarily uncovered. And we only want to expose the area of the body that we are cleaning with at that time. You want to check with the nurse in the care plan to determine what type of bath that the resident will be receiving. And you also want to consult with the resident to determine if they want to take a bed bath, a tub bath, or a shower. But you're going to do a combination of things, checking with the resident, making sure that what the resident wants lines up with the care plan, and also notifying the nurse, checking with the nurse. You want to make sure that the resident is using those safety bars in order to get in and out of the tub. And whenever you are bathing a resident or showering a resident, you never want to leave that resident alone. That's why we are getting all of the supplies that we need prior to us even starting the bath or subjecting the resident to the water or a bath environment. You don't want to use bath oils, powders, or lotions in the tub or the shower. This can cause the environment to be slippery and conducive to an injury or a fall from the resident. Always test the water with a bath water thermometer. You can test it against the inside of your wrist. You can also allow the resident to test the water prior to submerging their skin or exposing their skin to any bath water temperature. The bath water temperature should be anywhere from 90 to 105 degrees. It should not exceed 105 degrees to prevent burns or abrasions to the skin. You want to allow the resident to do as much as possible on their own. You want to use water only when you are washing the face, and a person that's unsteady when you are showering them, you want to make sure that you use a shower chair and that you lock the shower chair when it is in use. The next thing we're going to talk about is dressing the resident. Once again, when we're providing personal care, you always want to refer to the care plan prior to dressing the resident. You also want to know what limitations the resident may have. If the resident has experienced a stroke, they may, or if they have experienced some type of injury, they may be weak on one side of the body. You want to come into the know of this prior to you beginning to dress the resident. So always refer to the care plan and communicate with the nurse. You want to make sure that you are providing privacy, and if you've just finished bathing the patient, using a bath blanket will assist with the privacy that the resident will need while you're dressing them. You want to put the undergarments on first, and you never want to expose more than what is needed when you are dressing a resident. Remember that the resident may have one-sided weakness or weakness on one side of their body due to a stroke or injury. So this side is called the weaker side, or the involved side, or the affected side. You never want to refer to the weak side as the bad side when you are communicating with the resident. When dressing a resident who is paralyzed, you should dress the resident beginning with the paralyzed side first. You want to begin dressing them with the side that they cannot help you on first. This side is referred to as the weak side. So you're going to place the weak side through the sleeve first. For example, if you are dressing the resident and applying a shirt. The key factors that you need to consider when you are dressing a resident is the resident's choice, their preference for what they want to wear, as well as the weather. Make sure that the preference in what they want to wear is in line with the current weather. You want to encourage your resident to wear regular clothes during the daytime hours and nighttime clothes during the nighttime hours. Encouraging your resident to wearing daytime clothes during the daytime hours will encourage more activity for the resident and will assist them to spend more time out of bed. You want to encourage the resident to do as much as possible when you are assisting them to get dressed. Some residents may need assistance with physical or with verbal cues in order to help them maintain their independence and for them to regain self-care skills. So you may need verbal cues like asking the resident to lace up their shoes, reminding the resident to lace up their shoes or to buckle up their shoes. They may need physical cues with you maybe placing your hand on top of their hand as you help them pull their pants up above their waist. Remember, when you are undressing a resident, you're going to start with that strong side or the unaffected side. And when you are dressing a resident, you're going to dress them beginning with the weak side or the affected side. Let's talk about oral care. Oral care, like any other care that we will be providing to our residents, require that you utilize the care plan. The care plan is going to let you know what type of care you can and cannot provide to each resident, and the care plan will differ from one resident to the other. When we're providing personal care, remember that you will always use standard precautions when you are providing personal care to your resident. So we are providing oral care. We're going to consult the care plan, remembering that oral care is going to include cleaning the resident's mouth, their teeth, their tongue, and their gum. The nursing assistant must wear gloves, and they must be using standard precautions when they're providing oral care. Oral care is going to prevent halitosis, which means bad breath. So providing oral care prevents diseases and it prevents bad breath. Regular oral care will promote a healthier appetite by improving the taste for the resident. Oral care should be performed before breakfast. It should be performed after each meal and at bedtime. So around 4 times a day, at the minimum twice a day. Unconscious residents should receive oral care every 2 hours. Unconscious residents often breathe through their mouths. This can cause the secretions to stick to the surfaces of their mouth and can cause their mouths to be dry. So an unconscious resident will require more frequent mouth care than twice a day, more like every 2 hours or more frequently. When performing mouth care on an unconscious resident, remember you may have to turn their body to the side if there's an option on the test, or you can turn their head to the side. The purpose of turning their body or their head to the side is to prevent them from choking. You want to also make sure, of course, that you're using a barrier, but you want to prevent them from choking. And so allowing those fluids to drain out of the side of an unconscious resident's mouth will prevent them from aspirating. Aspirating is the inhalation of food or water or a foreign substance that's in the lungs. It can lead to pneumonia, which can in turn lead to death. So when we are providing oral care, we want to make sure that the head of the bed is elevated at least 30 to 45 degrees. Closer to the 45 degrees, you want to make sure that you're using a barrier. And if the resident is unconscious, you want to make sure that you turn their body or their heads to the side, because this person cannot gargle for you. This allows the fluid to drain out of their mouth to prevent them from aspirating. Also, when you are providing mouth care for a person that is unconscious, you want to make sure that you are not using a toothbrush or toothpaste when you're providing oral care for a person that's unconscious. You will need to use a mouth swab and cleaning solution. Once again, this person cannot gargle for you, so you do not want to run the risk of the toothpaste occluding their airway because they cannot gargle and remove it. Remember that if your resident is unconscious, if they're receiving oxygen, if they have tubes in their nose or their mouth, or if they're taking medicines that may cause their mouth to become dry, you may need to do more frequent mouth care than twice a day. So when you are providing mouth care, you want to make sure, that you have elevated that bed, that you're providing this resident with privacy, that you are practicing good hand hygiene and following standard precautions. You want to make sure that your resident that cannot gargle, that's unconscious, has their head or their body turned to the side to prevent aspiration while you are cleaning their teeth. You're going to clean the outside of their teeth, the inside of their teeth, and the chewing surfaces when you are cleaning their actual teeth. You also going to clean their tongue, and you're going to clean their gum when you are providing mouth care. When you're providing mouth care to an edentulous resident or a resident that does not have any teeth, you will not use a toothbrush and toothpaste. You will use a mouth swab and cleaning solution in order to clean the mouth of residents that do not have teeth. Remember that you're going to be using your barrier, providing privacy, and practicing standard precautions when you're providing mouth care according to the care plan. You can also be providing denture care to residents' dentures, which are artificial teeth. They may have a full set of dentures or a partial set of dentures. Once again, dentures are artificial teeth. You should wear gloves when handling a resident's dentures and follow standard precautions. You should always use the privacy curtain before you begin providing denture care. Many residents don't want to be seen without their dentures in place. Dentures are expensive, so you want to handle them with care when you are providing care to the dentures to prevent breaking or chipping of the dentures. When you are providing denture care, you want to line the sink with a towel and water to prevent the dentures from breaking, just in case they were to slip from your hands while you're actually cleaning the dentures. You're going to notify the nurse if the dentures were to break or they were to chip, because improper fitting dentures can stop the resident or cause complications to the resident while they're trying to eat. So if there is any damage to the dentures, you do want to let the nurse know. Your dentures should be stored in cool cleaning solutions. You never want to use warm water or hot water to clean your dentures. They can change the shape of the dentures or cause the dentures to warp. So you always want to use cool cleaning solutions when you're cleaning the dentures and when you're storing the dentures. Dentures that are left uncovered may crack. So you want to make sure that they are stored in a rinsed and clean denture cup with solutions that is labeled with the patient's name and their room number. You want to make sure that you place those dentures back in the place that they are normally stored. We want to keep up with the dentures. If dentures are lost while the resident is in a long-term care facility, it is the long-term care facility responsibility to replace those dentures. So as the nursing assistant, you want to make sure that you keep your eye out for these dentures. After you have cleaned them, you want to return them back to their place of storage. When you are removing the dentures or inserting the dentures, you're going to wear gloves. And then when you're removing the dentures, you want to remember to remove the bottom row first. You want to grasp the row with the gauze for a good grip, and you want to remove the dentures. The upper row of dentures is sealed with suction, so you want to grasp with the gauze and give a slight pull in order to break the dentures. You may have to rock them a little bit from side to side You're going to turn them at an angle to remove them out of the mouth. When you are assisting the resident to place their dentures inside their mouth, you're going to line up the top row with the gum line, and you're going to insert that top row first. And then you will insert the bottom row last. Before inserting dentures, you're going to apply the sealant to the actual dentures in order to make sure that the dentures are stabilized once they are in place. Once again, make sure that you are providing privacy and that you are using your standard precautions when you are providing denture care along with the care plan. When we are providing foot care, once again, you're going to refer to your care plan. You want to wash the feet. You want to wash in between the toes. You're going to make sure that you rinse and pat dry the feet. And you want to also make sure that the toes are dry, especially in between the toes, where it can be dark and it can be damp, and it can harbor bacteria or accumulate fungus in between the toes. So you want to make sure that the toes are dry in between. You want to give nail care to the toes of the foot if the care plan assigns it. You do not want to cut or trim the toenails of a resident that is diabetic or that they have a disease process that causes a compromise, a delay in their healing, or that may cause them to bleed easily. So you always want to follow the care plan carefully when you are providing foot care for a resident. If the care plan allows it, you want to apply lotion to the foot, especially to the heels. You do not want to apply lotion in between the toes. You want to remove any excess lotion with a towel. Most facilities have a podiatrist to come in to actually cut the toenails of a diabetic resident or a resident that has a disease process that causes delayed healing. That podiatrist comes in and provides the nail care or the foot care for those residents. So always follow the care plan. Never provide care for a resident and the care plan does not ask you to do so. For your diabetic residents, you want to make sure that you are checking their feet daily because diabetics experience neuropathy or decreased sensation to the nerves in the bottom of their feet. They may injure themselves or step on a nail and not be aware of it. So you want to make sure that you're inspecting your diabetics' feet daily, and you can teach them to inspect their feet by using a mirror in order to look at the bottom of their feet for any type of skin injury or any kind of skin breakdown that may be present. If you notice any skin injury or any skin breakdown, you want to notify the nurse. We're talking about shaving a resident now. You want to make sure when you are shaving a resident before you get started that you have consulted with the care plan. The care plan is going to tell you what you can and cannot do for each individual resident. Each individual resident have their own care plan that is tailored specifically to their care. Specifically, when you're shaving a resident, you want to consult with the nurse before you get started. You would like to know if the resident is on an anticoagulant and if they are on a blood thinner. You would like to know if the resident is wearing oxygen, if the resident is spastic, if they move suddenly. All of these things you want to take into consideration before you begin shaving a resident. You want to provide privacy. You want to use a barrier, and it's okay if you are shaving a resident to apply a warm towel to their skin to kind of soften up the hair before you get started shaving the resident. Once you have checked with the nurse to determine whether the resident is on an anticoagulant or not, you will determine whether you're going to be using a safety razor, a disposable razor, or a electric razor when you are providing care. If a resident has a beard or a mustache, We will provide daily care to their beard and their mustache. Most of the time, washing and combing the beard is enough to maintain it. You never want to trim or cut a resident's beard or mustache without their permission. Always consult with the nurse and refer to the care plan before providing any care in regards to shaving a resident. You have several types of razors. You want to check with the nurse to make sure which razor should be used on which individual. Remember, your safety razor has a sharp blade. It usually comes with a case to help prevent cuts. When you're using a safety razor, you will need shaving cream or soap in order to safely shave the resident. When using a disposable razor, you will also use shaving cream or soap. You remember not to recap a disposable razor, and you want to discard of a safety razor and a disposable razor in a biohazard container for sharps. The electric razor is going to be the safest and easiest type razor to use. It does not require any shaving cream. In electric razors, you need to remember the safety for electric razors. You never want to use an electric razor near water, and you never want to use an electric razor around oxygen, because electricity is required for an electric razor to work, and oxygen is highly flammable. So we do want to keep safety in the back of our minds when we are providing care for our residents. So in review, before we provide any care for our resident in regard to shaving, we want to make sure that we have checked with the care plan, that we've checked with the nurse and made sure that the resident is not on an anticoagulant or a blood thinner. Using a electric razor will be best for a resident that is on an anticoagulant or a blood thinner to prevent nicking and cuts that may cause bleeding. Shaving, when you're shaving a resident, this should happen in the resident's room or in the bathroom. And when you discard the razors, it should be discarded in a sharp container if you're using a safety razor or a disposable razor. You should not be sharing safety razors and disposable razors between individuals. Each individual should have their own personal care products. They should not be shared. If you are dealing with a resident that is spastic or that moves suddenly without you being aware, like a person that has dementia, this client will also be a candidate for the electric razor, which will prevent any nicks or cuts from sudden movement. You want to be aware of residents that are wearing oxygen and that need to be shaved with an electric razor. You want to go ahead on and consult with your nurse as to how you're going to shave that resident, because you should not be shaving a resident that's wearing oxygen with an electric razor. If the resident can tolerate it, maybe the nurse will allow the oxygen to be turned off during the shaving process. However, you do need to consult with the nurse for further instructions when you need to use an electric razor on a resident that is wearing oxygen, mainly because oxygen is highly flammable, and we want to keep the electric razor that works through electricity away from oxygen or water. When you're using an electric razor, you want to use circular motions when you are shaving the resident. When you're using a safety razor and a disposable razor, you want to hold the skin taut and use downward strokes on the face. And you're shaving in the direction of hair growth with that safety razor and that disposable razor. You're going to use upward strokes on the neck when you are shaving a resident with a disposable razor or a safety razor. Always consult with your nurse and always use the care plan. We're talking about now perineal care. This is another form of personal care that we will be providing to the resident. Remember that you are going to follow your standard precautions. You're going to provide privacy when you are giving perineal care. You're going to pull your privacy curtain or use a bath blanket, whichever is needed. You may even do both. When you are providing perineal care, this is a good time for you to observe the skin. You want to look for any discoloration in the skin. You want to look for any type of rash or any signs of skin breakdown in order for you to report this to the nurse. When you are providing care for the female resident, you want to clean from front to back. This is going to prevent infection when you are cleaning the female. You want to separate the labia, and you want to clean on the inside of the labia from front to back, and you want to make sure that you are using a different portion of the washcloth with each stroke when you are cleaning the vagina of a female. Remember, you separate the labia and you're going to clean from front to back on the left, the right, and down the middle. When you are cleaning a male, be mindful of the uncircumcised male. You will need to pull their foreskin back. You want to pull the skin to the base of the penis. You want to hold the penis by the shaft, and you want to clean in circular motions from the tip to the base of the penis when you are cleaning the penis during perineal care. Always follow the care plan when you're providing perineal care. Remember, with the uncircumcised male, you want to return the foreskin back down after you have cleaned the resident. You want to return the foreskin to its original position. You want to remember when you're providing perineal care to the male that you are going to wash the scrotum, and then you're going to wash the groin. It's important that you are observing the skin for any discoloration, any skin breakdown when you are providing perineal care. You also want to use a barrier to make sure that the linen on the bed is not getting wet, and you want to make sure that the patient is being given the privacy that they deserve while personal care is being provided. Always remember to use your care plan when you are providing personal care with the resident. Once again, the care plan is going to give you detailed instructions on what you can and cannot do when you are providing care to these residents. This is a list of the sources that I use to look up these vocabulary words for you and to give you a quick breakdown of these vocabulary words. This is a study tool, and it should not be your own source of study material as you prepare for the exam. So use this as a study tool. If you have more questions, please feel free to go to your textbook to that particular subject that you have questions in and give more detail, which will give you more detail on that subject. This is a study tool, so I'm pretty much just going over quickly the vocabulary words that have been presented to me, and hopefully this tool will be assistance of you as you continue to study and prepare for your state exam. Good luck, ladies and gentlemen.